If you have a scheduled pelvic floor physical therapy appointment and you're a little on edge, a little nervous, wondering maybe what should you expect with coming in for an appointment, this video is for you. My name is Brittany Cappiello, and I am a pelvic floor physical therapist who has devoted my entire career to helping women just like you. And so I've spent the last 20 years working with women with pelvic floor dysfunction, and it's really common for people coming in for evaluations to feel really on edge, really nervous. A lot of times their doctors don't really tell them what to expect with pelvic floor PT. They've heard about it, they've been recommended to go there, but they're not exactly sure what that entails. Over the years, I had a lot of women who would cancel their first-time appointments, and I was trying to figure out early on what was it that was causing people to cancel. And through conversation with clients, patients, I learned that a lot of why people were canceling their initial sessions was because of fear. So we did a whole write-up on our website, we did a video, and this was at the clinic I was working at for a number of years, and my cancellation rate went down because people were able to sort of connect with me and able to know a little bit about what to expect coming in for that appointment. And so while every physical therapist is a little bit different in terms of, what their sessions look like an initial evaluation, I can give you my perspective on an initial evaluation as a pelvic floor physical therapist and tell you how it goes on my end. So, as a pelvic floor PT, when someone is coming in for treatment, usually we have some sort of background information. Either we've connected with the patient, they've filled out an intake form, the doctor has sent over notes, whatever that may be, but usually we have a little bit of sort of background on what's going on with the patient or client. From there, I usually actually start off my evaluation session with just a conversation. So while I can look at paper and look at notes and read someone's past medical history, it's not the same as really having a conversation with somebody about what's going on. My goal as a pelvic floor physical therapist is to really get an impression of who you are, not just what's going on with your pelvic floor, but what's going on with your whole body. What's your stress level like? What's your diet like? How many kids have you had? What other sort of injuries or problems maybe have come about in your lifetime? Have you had knee surgery? Have you had a lot of ankle sprains? Did you used to be a dancer? Do you like to run? Sort of where are you at in life, and what did you used to do? What do you want to be able to do? What are you doing right now? And so I always start my sessions with just a conversation, asking a lot of questions, trying to just get a better feel for who you are and what your goals are so that I can best serve and meet your needs as a therapist. So after we sort of have some conversation, a lot of times what I do is I then will go into an explanation. When people are coming into physical therapy for a shoulder problem, they know what their shoulder is. They know the therapist is going to look at their shoulder. It's going to take them through range of motion, going to measure their shoulder. They get that. So they don't need too much explanation when they're coming in for their shoulder or their ankle or their knee. But when you come in for your pelvic floor, people aren't really sure, how does that get assessed? What does that look like? So I actually, instead of waiting until after we've done the assessment to really fully explain what I have found, I actually do a general explanation before we even start the session. So we do some subjective conversation talking, and then I go into explanation. I give a really general sort of overview of what the pelvic floor is, how does it function, why does it go into being dysfunctional, and how does that lead to symptoms. And I say, here's sort of the general. Here's what you need to understand and why we're going to do what we're going to do today. And so I explain the background behind all of the things we're going to do in the remainder of the session, so that as we're going through the battery of tests and assessments, the person understands and feels comfortable with the why behind it. It's not just some random person asking them to do this, do that, look at this, look at that. You really have a good understanding of what it is we're looking at and why we're looking at it. So I go through some explanation stuff first. After that, I usually get people up and moving. So I always do my body mechanics, biomechanic assessment next. So I may watch you walk. I may watch you do some lunges, stepping movements, squatting, patterns that are going to tell me how your body is moving through your pelvis, also through your hips, through your ankles, through your knees. Your pelvic floor is affected by everything in your body, both above the chain and below the chain, meaning that what happens at your feet and legs, as well as what happens from your head down to your pelvis. So I'll have you go through a battery of tests that are going to allow me to really assess how your body moves. How does your pelvis move with your body? How does your right side move compared to your left side? Do they move equal? Do they move different? Do you have pain? Take you through sort of some movement exam assessments. I will then do some upper body assessments. I'll have you do some arm reaches, different things. And again, looking at the same thing. How does your upper body connect with your pelvis? And does it move the same when you move your right arm versus your left arm? Does it move the same when you rotate your torso? What does your pelvis do? And so I will look at really the whole body. So I will look at upper body, I will look at lower body, and how your pelvis plays in with both. After we go through the movement assessment, and I'm a talker, so I tend to explain as I go. So as I'm doing things during the movement exam, I tend to explain to people what I'm seeing and why I'm doing it. I may even tweak or adjust it as you're doing it to see if something feels different, better, worse, the same. So I'll sort of explain as I go through. Again, every therapist is a little different. That's how I tend to do it. I feel like it puts people at a little bit more ease when they can understand why I'm looking at things, what it is I'm writing down as I sort of assess and take notes. After that, I usually get people on the table, fully clothed. What I want to do is just assess your range of motion. So I have them just relax down on their back, take their legs through some range of motion. What's their hip mobility like? What is their soft tissue doing? Are you tight? Are you restricted? What's your flexibility? I usually palpate or poke around through the abdomen, front of the pelvis. I often will have them roll over, palpate through the back of the pelvis, into the glutes, into hamstrings, the IT band, which runs down the side of your leg, and just really try to get a good assessment for what the soft tissue is doing. So we'll look at how you're moving, and then we'll look at what the soft tissue is doing. And then the last part is the part that everybody dreads. I usually do the internal last. By the time I get to the internal, I don't know if it's just me or if this is most physical therapists that do pelvic health, but I try in my head to really anticipate what I'm going to find internally, because what I find internally should match with what I'm seeing externally, meaning if you're not moving well in one direction or moving well on one side, often that's going to be the side that I find to be more dysfunctional when I do the internal exam. So I use all of the information I gather leading up to that point to help me sort of anticipate what I'm going to find internally and then put all of those pieces together. The internal exam is not like a gynecological exam, so it's totally different. There are no stirrups. There's no speculum. You're just relaxed with your knees bent. I often will tell people they can relax them open. You can keep them down and straight, whatever's comfortable. As long as I'm allowed to get access, it doesn't really matter to me sort of foot positioning or knee positioning, just whatever's comfortable for you. First, what I will usually do is I will palpate on the outside of the vagina. There are muscles that come up into the vaginal opening, and I will usually poke around those first to just see, is there any tenderness? Again, what's the right side feel like compared to the left side? If I actually grab my model here, I can show you what that looks like. So, put all my parts of my model back together. So this is the pelvis, okay? So this is looking up at somebody's pelvic floor as if they were laying on their back or lying on their back. This would be the vaginal opening. This is the rectum. And you can actually see that these are all muscles that are on the outside of the vagina. So that's what I'm poking at initially, is just sort of what do things sort of feel like on the outside? Does the right and left feel different? Do they feel the same? What do you feel tenderness-wise? Then usually what I'll do is I'll separate the labia and I will ask you to cough, or I will ask you to bear down, or I will ask you to do both. What I'm looking at when I do that is, do any of your internal organs start to drop down as you bear down or as you cough? I may ask you to do a Kegel exercise where you contract your pelvic floor. I want to see, are you able to contract? What happens to the tissues when you do that? And then after I've assessed all that, what I will do is I will actually go internal. I use gloves. I use a non-irritating gel. So the gel that I use has nothing in it, no fragrance, anything like that. So most people, even with allergies, do pretty well with it. I use the gel. What I do when I go internal is I use just one finger, okay? And if we go back to the model, you can see, and during your eval, you'll see this model. I go in and I assess all of these muscles which make up your pelvic floor. So right now you're looking down into the pelvis. So here's your pubic bone and here's your spine. Still somebody's laying on the back. You're just looking down into their pelvis now. And when I go in with one finger, what I'm doing is I'm going to assess these muscle groups, okay, all the way through. What am I looking for? I'm looking to see if something's tender. No different than if you woke up with sort of a kink in your neck and somebody decided to sort of check it out, like, ooh, you're really tight through there. That's what I'm feeling for internally with your pelvic exam. Do you have any tight spots? Is it tender? Is it worse on one side versus the other? And then what I do is after I assess all of that, I have you get changed, and then we sit back down and we talk. And I pull out the model again. I will show you where those tight spots were, or where we found some dysfunctional stuff, where you were tender, whatever it may be that we found. I will further explain how that relates to your movement exam and put all the pieces of the puzzle together. Based on that, what we will then do is the last part of the session is to come up with what the plan of care is. Do you need further visits? How often do you need visits? Do you just need a home program and we'll follow up in a few weeks, or we'll follow up in a month? Where do we start with a home program? So the last part after the internal is just a conversation, putting all the pieces together, making a plan to get you going. Often I will try to start you with a couple exercises just to at least take home and get something going. But usually there's at least one follow-up to establish a more personalized exercise program, plan of care, that sort of thing. So a lot of the first session, the evaluation, is really just assessment. Where are you at? What's going on with your body? What's happening with your pelvic floor? Let's come up with a plan. What is it that you think you need? What do I think you need? What do we sort of need to do together to help you to reach the goals that you're hoping to get? And then we move forward from there. It's really scary and it seems really intimidating, but I promise by the time we get to the internal portion of the eval, we'll have already been talking, you'll have been up and moving, you'll understand sort of where we're at with things, and it will seem sort of less scary and less intimidating than you think. I have a lot of women that tell me that it's less intimidating and scary than a gynecological exam. When I do your internal, it's not like I'm sitting between your legs like a GYN. I actually have your sheet covered, and I am with my one finger doing my assessment. I don't need to look after I do the initial palpation. So I really try to keep you as covered and sort of relaxed and comfortable as possible. The other thing I will tell women is if we get to that point and you're really panicky, we don't have to do it. You are in control of this session. So, and I would assume that every pelvic floor physical therapist would be the same. You get to dictate your treatment. So if you get there and you're like, you know what, today I'm not ready for it, that's okay. I usually will tell people, fine. Then based on what we found with your movement exam, let's come up with a plan based on that. Let's start you with some exercises based on that. And if in the next couple of sessions you're ready for the internal part, we'll do the internal part. It's really the ball's in your court. And if we start the internal and you're not comfortable, all you have to do is let me know and it's over. Okay, so I always make sure that people understand that they are in control. There is nothing that I'm going to force on you if you are not comfortable. If you're having too much pain, we can back off. We can stop for the day. We can wait till the next session. We can wait till, I have some women that I'll see for multiple sessions before we do the internal. Just depends on the person, comfort level, and sort of where they're at when we do the evaluation. But you are in control of your treatment, and every physical therapist, regardless of who you see, should be telling you the same thing. You need to be your own advocate. So if you're not comfortable with something, you're not going to hurt my feelings. You're not going to hurt your therapist's feelings. You need to let them know. You know your body better than anybody, above all, better than me, even with 20 years experience. You live in that body. You know it. You know your comfort level, and just make sure you're an advocate for yourself as you go through any therapy or medical procedures or sessions, but definitely in a pelvic floor PT session. Hope that helps. Hope you have a great first session. If you need anything on my end, make sure that you go ahead and reach out or check us out at mycorefloor.com for some personalized online exercises and care for your pelvic floor to get you started. Have a great rest of your day.